energy medicine, and understanding healing reactions. Understanding what happens when the body begins to heal. Introduction: why this topic is important. Many people start a new therapy expecting only one thing: immediate improvement. So when they feel tired, sore, or uncomfortable instead, they become worried. Questions arise. Is this treatment harming me? Is my condition getting worse? Should I stop the therapy? This lecture is meant to clarify, reassure, and educate. Because in many cases, what people experience is not harm, it is a healing reaction. 1. What is a healing reaction? A healing reaction is a temporary response that can occur when the body starts correcting long-standing imbalance. It is sometimes called an adaptation reaction, a therapeutic response, a re-regulation response. In simple words, when the body starts healing, it may temporarily feel uncomfortable before it feels better. This does not happen to everyone, and it does not mean something is wrong. Why do healing reactions occur? Many chronic health problems develop slowly over years. During this time, circulation may become poor, waste products may accumulate, nerves may remain in stress mode, muscles and tissues may become stiff or inactive. When a therapy, especially energy-based therapy, restarts circulation and communication, the body has to adjust. This adjustment can be felt. Think of it like muscle soreness after exercise, fatigue after jet lag, sleepiness after deep relaxation. These are signs of adaptation, not damage. What actually happens inside the body? When healing begins, several processes may occur. Improved blood flow, improved lymphatic drainage, activation of cellular repair, clearing of old metabolic waste, shift from stress mode to recovery mode. If these processes happen faster than the body is used to, symptoms can appear temporarily. This is especially common in chronic conditions, elderly individuals, people with long-standing stress or illness. Common types of healing reactions. Healing reactions are usually mild to moderate and may include fatigue or sleepiness, mild body aches or stiffness, temporary increase in old pain, headache or heaviness, flu-like feeling without fever, emotional release, calm, tearful, or irritable, changes in sleep or digestion. These reactions are temporary, self-limiting, usually followed by improvement. When do healing reactions appear? Healing reactions usually follow a predictable timeline. Some people feel changes during or immediately after therapy. Most reactions appear within 6 to 48 hours. They usually peak mildly and then settle. Most resolve within 1 to 3 days. In sensitive or elderly individuals, they may last 3 to 5 days. Reactions lasting longer than 1 week need reassessment. 6. Who is more likely to experience them? Healing reactions are more common in people who have chronic pain or illness, have been unwell for many years, are elderly or frail, have poor sleep or high stress, have dehydration or electrolyte imbalance, have metabolic conditions like diabetes or thyroid disorders. This does not mean the therapy is unsafe. It means the body needs a slower, gentler approach. Healing reaction versus adverse reaction. Very important. Healing reaction. Mild to moderate. Temporary. Settles on its own. Followed by improvement. Adverse reaction. Severe or worsening. Persistent. Causes functional decline. associated with alarming symptoms. Seek medical advice if there is severe or increasing pain, fever, fainting, new neurological symptoms, chest pain or breathlessness. Why fear makes healing reactions worse. Fear and anxiety can increase pain perception, activate stress hormones, delay recovery. When people understand what is happening, the same symptoms feel less threatening and settle faster. Education itself is a form of treatment. What can you do to reduce healing reactions? You can support your body in very simple ways. Hydration. Drink adequate fluids. Avoid excessive plain water. Include electrolytes if advised. Gentle movement. Light walking. Avoid complete bed rest. Avoid heavy exercise on treatment days. Rest and sleep. Allow the body time to recover. Do not push through fatigue. Nutrition. Eat simple, nourishing food. Avoid heavy or inflammatory meals. Communication. Inform your therapist about reactions. Therapy can always be adjusted. These steps greatly reduce discomfort. Should you stop therapy if a healing reaction occurs? In most cases, no. Instead, intensity can be reduced. Frequency can be adjusted. One modality can be used at a time. Healing is not about pushing harder. It is about working within the body's comfort zone. Why some people feel better after the reaction. Once the adjustment phase settles, many people notice reduced baseline pain, better sleep, improved mobility, improved energy, a sense of lightness or ease. This is why healing reactions are often described as uncomfortable, but followed by relief. 2000 important message for patients. If you experience a healing reaction, remember, you are not failing. The therapy is not harming you. Your body is adapting. Healing is not always linear. It often happens in steps. Final message, a calm reframe. Healing reactions are not something to fear. They are signals that the body is responding and reorganizing. With proper guidance, gentle pacing, and good self-care, healing reactions become shorter, milder, and less frequent. Understanding what is happening turns fear into confidence and discomfort into reassurance. Thank you for listening. Founder, Holistic Wellness Foundation. Imphal, Healing Beyond Boundaries.